prostate cancer is a malignant growth or a cancerous growth within the prostate that affects men as they get older. There are currently about 50,000 new men diagnosed with prostate cancer every year, and in the UK there are at least 500,000 men currently living with the disease. Unfortunately, we're still losing almost 10,000 men every year from the disease. Testing for prostate cancer is still primarily done via the PSA blood test. So if you're age 50 or over, or indeed 45 if you're black or have family history of prostate cancer, then please do see your GP to get your PSA checked. It's not a perfect test, but it's the best that we've got. And if your PSA is elevated, that does not necessarily mean you have prostate cancer. It just helps identify men who need to go on to further testing by way of an MRI scan. And MRI scans nowadays are very good at picking up men who have significant disease from men who do not have significant disease. Risk factors for prostate cancer include increasing age, family history, which is why it's really important if you do have a family history of prostate cancer or indeed breast cancer and you're over the age of 45 that you see your GP to get yourself checked. The shame is that prostate cancer is not picked up early enough in some men, and if it is picked up early enough, it's one of the most treatable cancers. Unfortunately, however, in the early stage of the disease, there aren't actually that many symptoms. However, if you did get symptoms from prostate cancer, these might be things like difficulty urinating, getting up at night to pass urine, slow flow, that sort of thing. But with more advanced disease, you can start getting things like leg swelling and bone pain. As mentioned, prostate cancer is one of the most treatable diseases, but it all depends on what sort of prostate cancer you've been diagnosed with. Is it low risk? Is it intermediate risk? Or is it high risk? If picked up early and you've been diagnosed with low risk cancer, you might not need any treatment at all. And in fact, for the most part, these men are just monitored with a series of PSA tests and MRI scans. And this is called active surveillance. So we're actively monitoring a man's prostate over the months and the years to look for any change. And if it does change, then we can jump in and re-scan or re-biopsy and treat men before it progresses. If you do have intermediate or high risk prostate cancers, then treatment is almost certainly recommended in that situation. And this can include removal of the prostate with a robot or indeed hormonal manipulation followed by radiotherapy. Nowadays, there's also focal approaches to prostate cancer treatment, and this is usually reserved for men with low to intermediate risk disease and some high risk disease in very selective cases. And this is where we target only the area of abnormality in the prostate and treat that rather than treating the whole prostate as you would with surgical removal or radiotherapy. And the main benefit of this is the great functional outcomes that you get, the minimal impact on your quality of life. Side effects such as urinary incontinence or erectile dysfunction are kept to well below 1% with the focal approach, rather than up to 40% or more with the conventional whole gland treatment approach. Nevertheless, the take-home message is this: if you've not had your PSA blood test checked or you've got any of the risk factors previously discussed, please do consult with your GP to see if you need to have any further investigations.